Attention Deficit Hyperactivity Disorder is a chronic condition that affects millions of children and often continues into adulthood. ADHD includes a combination of persistent problems such as difficulty sustaining attention, hyperactivity, and impulsive disorder. Children with ADHD may also struggle with low self-esteem, troubled relationship, and poor performance in school. Treatment won't cure ADHD, but can help a great deal with symptoms. Treatment involves medications and behavioral interventions. Early diagnosis and treatment can make a big difference in outcome. Features of ADHD include inattentive and hyperactivity impulsive disorder. ADHD symptoms start before age 12. In some children, it is noticeable when they become 3 years old. ADHD symptoms can be mild, moderate, or severe, and can continue into adulthood. ADHD occurs more in males than in females, and behaviors can be different with boys and girls. Boys may be more hyperactive, and girls may tend to be quietly inattentive. There are 3 subtypes of ADHD. Predominantly inattentive. The majority of symptoms fall under inattentive. Predominantly hyperactive or impulsive. The majority of symptoms are hyperactive and impulsive, and combined, a mix of inattentive symptoms and hyperactive and impulsive symptoms. Inattentive. A child who is inattentive may often fail to pay close attention to details or make careless mistakes in schoolwork. Have trouble staying focused in tasks or plays. Appear not to listen even when spoken to directly. Have difficulty following through on instructions and fail to finish schoolwork or chores. Have trouble organizing tasks and activities. Avoid or dislike tasks that require focused mental effort, such as homework. Lose items needed for tasks or activities, for example, toys, school assignments, pencils. Be easily distracted and forget to do some daily activities such as completing few chores. A child who shows hyperactivity and impulsivity symptoms may often fidget with or tap his or her hands or feet or squirm in their seats. Have difficulty staying seated in the classroom or in other situations. Be on the go in constant motion. Run around or playing in situations when it's not appropriate. Have trouble playing or doing activity quietly. Talk too much. Blurt out answers, interrupting the questioner. Have difficulty waiting for his or her turn, interrupt or intrude on others' conversations, games, or activities. Most healthy children are inattentive, hyperactive, or impulsive. It's typical for preschoolers to have short attention spans and be unable to stick with one's activity for long. Even in older children, teenagers, attention deficit often depends on the level of interest. The same is true for hyperactivity. Young children are often energetic. Also, some children have a higher activity level than others. Children who have problems in school but get along well at home or with friends are likely to struggle with something other than ADHD. The same is true for children who are hyperactive and inattentive at home, but whose schoolwork and friendships remain unaffected. If you're concerned that you show signs of ADHD, see your pediatrician or family doctor. Your doctor may refer you to a specialist such as developmental behavioral pediatrician, psychologist, and psychiatrist, or pediatric neurologist. But it's important to have a medical evaluation first to check for other possible causes of your difficulties. The cause of ADHD is not clear. One of the factors that may be included is genetics, the environment, or problems with the central nervous system at key moments in development. Risk factors include blood relatives such as parents or siblings with ADHD or another mental health disorder, exposure to environmental toxins such as lead found mainly at paint and pipes in old buildings, maternal drug use, alcohol use, or smoking during pregnancy, and premature birth. Sugar is a popular suspect in causing hyperactivity, but there is not reliable proof of this. Many issues in childhood can lead to difficulty sustaining attention, but it's not always the same as ADHD. Uh, ADHD can make life difficult for children. Children with ADHD often struggle in, in the classroom, which can lead to academic failure and judgment by other children and adults, tend to have more accidents and injuries of all kinds uh, uh, than do children who don't have ADHD, tend to have poor self-esteem, are more likely to have trouble interacting with and being accepted by peers and adults, are at increased risk of alcohol and drug abuse and other delinquent behavior. ADHD doesn't cause other psychological or developmental problems. Children with ADHD are more likely than others to also have conditions such as oppositional deficit disorder, generally defined as a pattern of negative, defiant, and hostile behavior toward authority figures, conduct disorder, marked by antisocial behaviors such as stealing, fighting, destroying property, and harming people or animals, disruptive mood dysregulation disorder, characterized by irritability and problems tolerating frustration, and learning disabilities, including problems with reading, writing, understanding, and communication. More coexisting conditions are substance use disorders, including drugs, alcohol, and smoking, anxiety disorders, which may cause overwhelming worry and nervousness and include obsessive-compulsive disorder or OCD, mood disorders, including depression and bipolar disorder, which includes depression as well as manic behavior autism spectrum disorder, which is a condition related to brain development that impacts how a person perceives and socializes with others, and tic disorder or Tourette syndrome, disorder that involves repetitive movement or unwanted sounds that can't be easily controlled. To help reduce your risk of ADHD during pregnancy, avoid anything that could harm fetal development, for example, don't drink alcohol, use recreational drugs, or smoke cigarettes. Protect your child from exposure to pollutants and toxins, including cigarettes, smoke, and lead paint. Limit screen time, although still unproved. It may be prudent for children to avoid excessive exposure to TV and video games in the first 5 years of life. People with ADHD need to be less than 12 years to get diagnosed. They should also create significant progress at home and at school on an ongoing basis. There is no specific test for ADHD, but making a diagnosis will likely include medical exam to help rule out other possible causes of symptoms, information gathering, such as any current medical issues, personal and family medical history, and school records, interviews or questionnaires for family members, your child's teachers, or other people who know your child well, such as caregivers, babysitters, and coaches. ADHD criteria from the Diagnostic and Statistical Manual of Mental Disorders, published by American Psychiatric Association. ADHD rating scales to help collect and evaluate information about your child. Signs of ADHD can sometimes appear in preschoolers or even young children. Diagnosing the disorder in very young children is difficult. It's because developmental problems such as language delays can be mistaken with ADHD. They need to get an evaluation by a specialist, such as psychologist or psychiatrist, speech pathologist, or developmental pediatrician. A number of medical conditions or their treatments may cause signs and symptoms similar to those of ADHD. Examples include learning or language problems, mood disorders such as depression or anxiety, seizure disorders, vision or hearing problems, autism spectrum disorder. Autism spectrum disorder refers to a broad range of conditions characterized by challenges with social skills, repetitive behavior, speech, and nonverbal communication, medical problems or medications that affect thinking or behavior, sleep disorders, and brain injury. Medication, behavioral therapy, counseling, and education services are all types of treatments. These treatments can relieve many of the symptoms of ADHD, but they don't cure it. Stimulant medications are the most commonly prescribed medications for ADHD. Stimulants are made to balance levels of brain chemicals called neurotransmitters, which we talked about in anxiety disorder. These medications help improve the signs and symptoms of inattention and hyperactivity.
Stimulant medications and certain health risks. Some research indicates that using ADHD stimulant medications with certain heart problems may be a concern, and the risk of certain psychiatric symptoms may be increased when using stimulant medications. Heart problems. Stimulant medication may cause an increased blood pressure or heart rate. The increased risk of serious adverse effects or sudden death is still unproved. However, the doctor should evaluate your child for any heart condition or family history of heart disease before prescribing a stimulant medication and monitor your child during stimulant use. Psychiatric problems. Stimulant medications may rarely increase the risk for agitation or psychotic or man- manic or manic symptoms with stimulant medications use. Contact the doctor immediately if your child has sudden new or worsening behavior or sees or hears things that aren't real while taking stimulant medication.
So other medications for, well, first of all, let me get back to this. Reintroduce the topic, I guess, because, no, let's just continue. Other medications that may be effective in treating ADHD are these drugs. I don't want to mind reading them. Antidepressants and all those type of stuff. Atomoxetine and antidepressants are slower than stimulants, and it may take several weeks before they take full effect. It's maybe a good option if your child can't take stimulants because of health problems, or if stimulants cause severe side effects. I do not recommend drugs in the first place, so we can continue. Suicide risk. Although it remains unproven, there's still a slight risk of suicidal thinking with people that have ADHD, and children that take antidepressants and stimulants and non-stimulant ADHD medication can end up in suicidal thoughts. Contact your child's doctor if you notice any signal of suicidal thinking or other signs of depression. So ADHD medication can lead to antidepressants. So that's what can lead to suicidal thinking. So that's why in the first place I don't recommend drugs and this type of medication. All right. Next slide. How to safely give medication. So you have a child that has ADHD. What's the best safe way to give this guy medication and solve his problem? It's important to make sure the child takes the right amount of prescribed medication. Parents may be concerned about stimulants and the risk of abuse and addiction. Stimulant medication are considered safe when your child takes medication as prescribed by the doctor. Quick question, Mr. Natfon. What's the difference between stimulant medication and non-stimulant medication? By any chance, do you know?
A stimulant a stimulant increases the number of neurotransmitters in between neurons. So there's a receptor and then the dendrites that release the neurons into the space in between. So that's a stimulant. It stimulates you, mainly acting directly onto your nervous system. So non-stimulants would either be a reuptake inhibitor or something that decreases the amount of neurotransmitters. So for ADHD, most of the patients actually are prescribed stimulants, and like the list of stimulants ranges from all sorts of things like Ritalin, Adderall, dextrothin, all sorts of stuff that mainly increases dopamine because there's a problem in the concentration of dopamine in your synaptic cleft. And if it's confusing what I'm saying, I'm going to try real quick.
Okay.
And no, I attached a picture so you can see in the chat because it's important so you get a visual of what I'm talking about. But that's what it is, okay?
Okay. That makes sense.
There.
Your child, let me just open up the picture to see what you're talking about.
So where it says neurotransmitter in that picture,
Yeah.
the line goes in between those two spaces. That is where the stimulant medication increases the amount of neurotransmitter in there. Because the more you have, the faster the behavior, the more enhanced your focus, the better your response to certain nervous system cues, and the more regulated your ADHD symptoms will be.
Oh, okay. So when you give it stimulants, it fixes the inattention that people with ADHD could possibly have and increase their response.
Yeah. Now the one caveat to that is that the problem is you don't want to develop tolerance because you want to try and combat this on your own, right? Drugs help, but then the problem with drugs is you get dependent on them. And so if a child is only good at taking tests on Ritalin, and then when they're off the Ritalin and they still can't take and focus, it's debatable. Is that good? No, it's not. So then how do you behaviorally modify that? It's challenging, but doctors try their best.
What I know of this ADHD is that as you grow up, it fixes normally, or
it can.
Not, okay.
Yeah, it can. I mean, I know doctors with ADHD, but they modify it, you know, and they just work with it. Yeah. So some of them are brilliant. So it just depends. It's not an impairing illness like some of these serious deficiencies in cognition, but it's something that can be managed.
Okay. So,
okay.
You want to jump in?
I have just something to say. I was here from the beginning of the period, but I got disconnected from Microsoft Teams itself about 1 minute ago, and I came back.
Okay.
Okay.
So, as we can see that medication is a good thing, but it's kind of risky because there's a concern that people might misuse or abuse these stimulants or possibly get dependent on it. So, in my opinion, I would advise that medication should be given in the most important cases, severe cases. It's not severe, I think it is manageable. This is my personal opinion. Any questions so far, guys? I think we're good. All right. Next slide. Giving medication safely, as we said, if medication is given, it needs to be given carefully. Children and teens should not be in charge of their own ADHD medication. At home, keep medications locked in childproof containers. You need to just make sure that the child is not the one in charge of the prescription. Next slide. Okay, ADHD behavioral therapy. We kind of talked about behavioral therapy yesterday. Does anybody remember what this is?
Therapy that works kind of like medication, like a cure almost.
Yeah, it's kind of training for the brain, if you can consider that. So thank you, Saif.
I have a question.
Go ahead.
Yeah, sorry for interrupting, but I just want to know that I know it is ADHD, so it's a mental disorder that happens for children, but in what kind of way? Like, um, how does it differ from other mental disorders?
What's the question again? I did not hear you properly.
Yeah, just to make sure that I am on the same track. What kind like of mental disorder is ADHD like that happens to children? Like, what are
They
its
become hyperactive, they become
yeah,
impulsive, the,
They
the
become they
attention decreases,
yeah they
and
can't
the mem-
pay attention to something for a long time. They're always fidgety. Um, they don't pay attention. They always have a lot of activity in them, and they can't pay attention to a certain material at a certain time.
and it is genetic.
Yes, it is genetic. Mainly genetic and environmental factors play the biggest role.
Oh, oh yeah, now I got it. Thank you.
All right, sure, anytime. Um, Children with ADHD often benefit from behavior therapy and social skills training. Parent skills training and counseling, which may be provided by psychiatrists, psychologists, social workers, or other mental health professionals. So what they do is they literally train the child that has ADHD with certain behaviors and social skills that they need um, in order to overcome this condition. And they could also train parents on how to deal with the child that has ADHD. Um, some children with ADHD may also have other conditions such as an anxiety disorder or depression. In these cases, counseling may help ADHD and the coexisting problems. So ADHD can lead to other mental disorders such as anxiety disorder and depression, the two topics that we talked about before. Um, if in these cases you have to deal with ADHD and the coexisting conditions such as anxiety disorder and or depression. And as we said last time, yesterday and on Sunday, um, for anxiety disorder and depression, there's a lot of therapy um, and other types of treatment that you can give to um, the person with the condition. Any questions, or we're good? Um,
They can also use
be-
Adderall.
yeah, you can use drugs.
Yeah, but it's not healthy, I think.
Yeah, I mean, if it's a severe condition and the guy's about to kill himself, then maybe it is necessary. But most of the time, it's not that. I mean, it's going to give him some breathing space for possible medication or treatment or therapy, but it's not a long-term effect. ADHD behavioral therapy, um, the types of therapy or things that you can do to hopefully resolve the problem. Behavior therapy, teachers and parents can learn behavior changing strategies such as token reward system and timeouts for dealing with difficult situations. So, kind token reward system, I would guess that if they do something wrong, right, they give them a token, and then the more tokens they have, they can do good stuff with them that they'll be happy about, and in that way they train them to fix their condition. Social skills training, well, they train them for appropriate social behavioral skills to cope with their ADHD. Not necessarily fix the condition, but just to cope with it and know how to act while having it. Parent skills training, they train the parents to deal with their child. Psychotherapy, we talked about this yesterday. Anybody remember what psychotherapy is?
I think I know, but I'm not sure. Psychotherapy is it like the therapist or the person who people are depressed or having anxiety problems go to, and he listen to them and give them solutions.
Yeah, so they talk about their problems, things that bothers them,
Yeah.
and he tries to fix them and convince the person that everything's okay, and if he tells, just finding solutions to their problems basically. Family therapy is giving help to parents and siblings to deal with the person with ADHD, just to cope with the condition. The best results occur when a team approach is used. What do they mean by this? It's okay. So they'll say there is a person with ADHD. His school, his parents, his siblings, and psychiatrists and therapists, they're all working together and learning ways to cope and deal with the child with ADHD, and hopefully resolve the situation and make him trained enough to cope with the disorder. Teachers, parents, siblings, everybody works together to fix the problem. That's, in my opinion, that the best results happen when this team approach is used, because everybody's working together to fix this child's problem. Next slide. Okay, so there's this new medical device, which is called ETNS, external trigeminal nerve stimulation system. This thing, what happens is, this thing is the size of a cell phone, and there is a band that you put on the forehead. It is used home under parental supervision when the child is sleeping, and the device generates low-level electrical stimulation which moves through a wire to a small patch placed on the child's forehead, sending signals to areas of the brain related to attention, emotions, and behavior. ETNS is being considered it's most important to discuss precautions and possible side effects. So yeah, they put a device that has, go to the next slide, Rayan. Okay, so you see the band on the forehead sends out electrical signals, and it's specifically to cope with the inattention part of ADHD, and it sends out signals because, as we know, as Mr. Natafon said yesterday, the brain works through a lot of electrical and chemical activity. So what this tries to do is it tries to regulate the electrical activity in the attention part of the brain through sending electrical signals. Or am I wrong, Mr. Natafon? Because I'm not too sure of this.
That's well said, yeah.
Okay, we're good. So, but this thing, it may have side effects, so it may need to have a check on this. Okay, this is okay. Ongoing treatment. If the child is being treated for ADHD, he or she should see the doctors regularly until symptoms have largely improved, and then typically every 3-6 months if symptoms are stable. So if he's getting training and therapy, symptoms are going to decrease largely, and he needs to get treatment instead of going to the doctor every 2 to 3 days, he's going to go every 3 to 6 months because his condition is under management. Excuse me. Call the doctor if your child has any medication side effects, such as loss of appetite, trouble sleeping, or increased irritability. If your child's ADHD symptoms have not shown much improvement with initial treatments. So just basically on treatment. Okay, to help cope with this, there's other lifestyle changes that you can do, that the child can do to hopefully cope with the ADHD. such as yoga or meditation. These are regular exercises and routines that you could fit into the daily schedule that may help the child relax and hopefully pay more attention and learn how to be disciplined. It helps manage their symptoms of ADHD. Special diets. Most diets for ADHD involve eliminating foods thought to increase hyperactivity, such as sugar and common allergens such as wheat, milk, and eggs. Some diets recommend avoiding artificial food coloring, additives. Okay, so basically, special diets that your brain also has to feed on something, and if your brain is feeding on the wrong stuff, it may cause a disorder. So there's a lot of special diets to hopefully help cope and hopefully fix the situation. Right, next slide. Vitamin and mineral supplements, herbal supplements, and proprietary formulations. These products made from protein, micronutrients, and other ingredients that are sold as possible treatment supplements for children with ADHD. So things that hopefully fix the condition of the neurotransmitters, vitamins and minerals, and all types of good stuff. Next slide. How much time do you have? Oh no, 3 minutes. Okay. Essential fatty acids and neurofeedback training, also called this long word. These sessions, child focuses on certain tasks while using a machine that shows brainwave patterns. Oh, so they hook up something to their brain that shows their wave pattern, the wave patterns of the brain, while doing the specific task, and that can keep track of the brain activity and see progress on the training. Next slide. Coping and supporting. Caring for a child with ADHD can be challenging for the whole family. So basically, in this thing, it's like siblings and parents of the child with ADHD need to help in helping the child in coping with ADHD. It requires time and effort, but with the right type of treatment, it is possible to decrease the symptoms of ADHD. Next slide. Resources. There are many resources and information that you can get on this. There's a lot of good books by many doctors that are available. Next slide. Strategies for coping. Parents can notice patterns in the child's behavior, as well as their responses. There's not enough time. I think we can skip this because it's kind of repetitive. Next slide. Stay calm is such a good example. Take time to enjoy your child. Be happy, I guess. Next slide. Strive for healthy family relationships. Give yourself a break. Every now and then, don't feel guilty for spending a few hours apart from your child. It's okay to let the child leave the child. Next slide. Preparing for your appointment. There's not enough time. I don't think we'll go. Yeah, it's the period, so kind of. What do you do?
3 more slides. 3 more slides.
You're likely to start by talking to your child, to a family doctor or pediatrician, depending on results of initial evaluation. If a child has ADHD, you need to go to a specialist, such as development, behavioral. Just go to an expert. What can you do? Make a list of symptoms and difficulties your child has to take at home. Prepare key information. Make a list of all medications. Bring any past evaluations and results of formal testing. Make a list of questions. Basically, everyday doctor stuff that you need to prepare. What to expect from the doctor? He's going to ask a lot of questions about the condition of the child, such as these right there. I don't need to go through them all, but just general questions about the condition: how much what he eats, what he's learning, does he pay attention, is his grades good, and so on and so forth. What to expect from the doctor is going to give you mental and health professional advice based on the responses that you give to the questions and the symptoms that you have and need. Preparing, anticipating questions help make the most of your time with the doctor. Next slide.
Thank you for your attention. It's the end of the period and it's the end of the presentation. Thank you.